here at Frontiers Health 2025. I'm joined by Jack Kreindler, the CEO of WellFounded. Just got off stage talking about humans in extremes, and your startup is in the longevity space. Tell me a little bit, kind of the 15, 20-second pitch, what WellFounded does.
20-year startup, but yeah, so not really a startup. The talk was about our work in extreme environments and how, as a team of physicians and scientists, we look at people in extremes, either occupational extremes like military expeditions or occupations like startups, a lot of founders, study them, see how people survive, how they thrive, how they fail, and then apply that to help people achieve better outcomes in their life, their work, but also for very sick people to see how we can get better survivorship. And that's the bulk of our work.
That's fascinating. Can you give me one example, sort of?
Well, I talked about our expedition to the South Pole, looking at why in hyper-endurance settings, that's where you're doing an awful lot of work and not able to consume enough calories, and it's usually in a very, very horrible and extreme environment. Well, if you like places like the Antarctic, like me, it's not horrible, but we look at various factors, psychological, biological, physiological, with biosensors, with bloods, and with asking people lots of questions, how they're getting on. And we discover why it is that, for instance, women preserve muscle mass better than men, and perhaps what are the fundamental things that help people do better in a human interaction kind of sense. Take that and develop that into protocols so people like you and me can, in our extremes of age, as we get into our 80s and 90s, how we can be thriving rather than just surviving.
That's fascinating. How do you action those insights? Is it through kind of development of like drugs or technology, or you said protocols? What does that mean?
Well, for instance, I mean, I can't see you wearing one. I haven't either. But let's say an Oura ring. So one of the devices that we took on the Antarctic expedition was a number of wearables, and seeing which ones perform well, which ones don't. Obviously, really pushing those things to an extreme helps us understand how older people, perhaps who haven't got abilities to move their hands properly and to work technology in a predictable way, how they would be able to use these kinds of devices to be able to help their physicians, their care network, their friends, family, loved ones to look after them and gain insight into what's working and what's not. So that's a classic insight. Use things in extremes and then convert them and translate that into folk who don't usually go to places like that.
And what do you think folks at Frontiers, who are on all kinds of health innovation journeys, can learn from the work that you guys have been doing over the last 20 years?
Think less about disease and saying, where is the disease coming from? And think more about extreme success, extreme endeavor. The folk who manage somehow or other to either be immune or very resilient to breaking in tough situations physiologically. So I would say think about human performance versus disease. The secret sauce there in people that perform incredibly and unusually well is probably what we should be looking at more than just trying to fix the disease once it's happened.
Great lesson, and I'm sure one that's very applicable to so many parts of this space.
Absolutely.